I was reading the newspaper, and I came across an article about Dr. Claudia Henschke and a project she was doing, and it interested me because I had been a smoker. And the article said that Dr. Henschke was proposing that people who had been smokers should go through a CT scan. Now, I was a healthy person. I went for my physical checkups every year. I had clear lungs and all of that. But I had been a smoker. I had stopped for a number of years. And everything that I had read indicated that why not, make sure.
Mr. Johnson came in to have that first low-dose CT scan, and we found a tiny nodule that we thought required further workup. He received another CT scan and then went for a biopsy, and he was found to have lung cancer.
He had a lesion in his lung that was caught by Claudia Henschke's CT screening program. Then he ended up coming to see me. I reviewed his films and I thought, yes, he should have surgery to go ahead and get this out. I think it was key that he was part of the lung cancer screening program. I think he's alive today because of it, and he enrolled himself into it. He was concerned about getting lung cancer, and he was proactive.
I never thought I would have cancer. You never think you'll have something like that. I thought I was leading a healthy life. Even though I had smoked, I had stopped smoking. I hadn't smoked in years. And here I was, I get the news that I have a spot on my lung? That can't be.
There are about 160,000 deaths from lung cancer each year. That's more than breast cancer, prostate cancer, and colon cancer combined. Part of the reason is that lung cancer doesn't produce symptoms until it's in late stage. So it's very hard, in the absence of a screening program, to find it early. For the other diseases, breast cancer, colon cancer, and prostate cancer, there are methods of early detection, and there are screening tests that are used. And that has not been the case for lung cancer. The
best way we can treat this disease at the moment is to catch it early. Now, there's a lot of research going on, looking for the magic bullet to cure lung cancer, to cure cancer in general. Right now, we have to use what we have at hand to help cure lung cancer. Low-dose CT scanning is the way to catch it.
An X-ray does give you some information, but it's like I only have 2 images of the chest, whereas with a CT scan, I have as many as 800 images. So just by that, it's clear that I can see many more small things. I can see something as small as a grain of rice, whereas on a chest X-ray, I see something like a golf ball. So you see that you can find the cancer much earlier with a CT scan than you can with a chest X-ray.
If you catch it earlier when it's smaller, you can take it out with a greater chance of cure and a less lung removed and minimally invasive surgery where you have 3 small holes as opposed to doing a bigger incision, and where you can preserve most of the lung. When cancer's advanced, sometimes those patients need to lose their whole lung, and their rate of cure isn't as good as well. So catching it early is really the key to curing more people with lung cancer.
This cancer was caught at the very earliest stage. I didn't have to have chemotherapy. I didn't need radiation. It was taken out. So I was very fortunate. I owe my life and where I am today, a healthy 72-year-old man, to Dr. Claudia Henschke, and that's the truth, and to Dr. Flores.
And I would say that getting a CT scan is so simple, especially if you've been a smoker or, as John said, been exposed to environmental toxins. So get the CT scan, and as I said, it's simple and it could save your life.
It's a very emotional thing to know that your life has been saved by somebody who was prescient enough to do the CT scan and to have a protocol like this, and then have a fine surgeon who took it out and saved my life. It's wonderful.